Hi, everyone. It's now a little after 3 o'clock Eastern Time. You have joined the webinar for implementing evidence-based strategies to reduce overdose risk during reentry. To allow for additional sign-ins past the hour, we will be starting in about 1 minute. Hey, hi, everyone, and happy Second Chance Month. Thank you for joining today's webinar on implementing evidence-based strategies to reduce overdose risk during reentry. My name is Felicia Lopez-Wright, and I'm a project manager at the Council of State Governments Justice Center, and I will be facilitating today's webinar. Next slide, please. To give you an outline of today's webinar, first, I will provide a brief overview of the CSG Justice Center and an introduction of our speakers. Then we will hear about the strategies to reduce overdose risk during reentry from an upcoming resource that will be released to the field soon. Finally, we will hear from our panelists about how they're using the Second Chance Act grant funding to implement overdose prevention strategies in their jurisdictions. And we will also have time for questions and answers before wrapping up. So just a few housekeeping items before we continue. Anytime during the webinar, you can ask a question by clicking on the Q&A button at the bottom of the screen and entering your question. This includes both technical and content-related questions. We will try to reply to technical questions in the chat as we go. For the content-related questions, we will keep a running list and address them at the end of the webinar. We will do our best to go through as many questions as possible. If you encounter technical or audio problems during this webinar, refer to the information that's posted in the chat shortly. Please understand that there are some technical issues that we may not be able to resolve, but we are recording the webinar and we will post it along with the PowerPoint slides on our website within 2 weeks. Next slide, please. Okay, the Council of State Governments Justice Center is a national nonprofit, nonpartisan organization that combines the power of a membership association representing state officials in all 3 branches of government with the expertise of a policy and research team focused on assisting others to attain measurable results. Our staff develops research-driven strategies to increase public safety and strengthen communities. Next slide. This slide describes a bit more about our work style and how we strive to reflect the Justice Center's core values, which include a commitment to being independent and nonpartisan in every aspect of our work, providing rigorous, trusted, high-quality analysis, developing practical and innovative solutions informed by data and research, promoting collaboration and building consensus, and being inclusive and respectful of diverse views and experiences. Next slide. The overarching goals that guide our work at the CSG Justice Center are to break the cycle of incarceration, advance health, opportunity, and equity, and use data to improve safety and justice. Next slide. And this is our equity and inclusion statement. So the CSG Justice Center is committed to advancing racial equity internally and through our work with states, local communities, and tribal nations. We support efforts to dismantle racial inequities within the criminal and juvenile justice systems by providing rigorous and high-quality research and analysis to decision makers and helping stakeholders navigate the critical and at times uncomfortable issues data reveal. We rely on stakeholder engagement and other measures to advance equity, provide guidance and technical assistance, and improve outcomes across all touchpoints in the justice, behavioral health, crisis response, and reentry systems. Next slide. So here's a list of our speakers. I'll just run through and give you a little bit of an introduction to each of them. So first we have Reneka Greenlee, and she's a master's level social worker and became employed at the McNabb Center shortly after graduating from East Tennessee State University in 2015. And prior to her work in the recovery field, Reneka worked in settings to include private practice, program startups, in-home services, and nonprofit organizations. Reneka is a services coordinator for reentry at the McNabb Center and is the direct supervisor at the Jail to Work Reentry program. Reneka is committed to helping individuals find that recovery is possible and that a life worth living can be created. And we also have Marisol Torres Napoleoni, who has a bachelor's degree in psychology with a minor in women's and gender studies from the University of Puerto Rico. She has also a master's degree in counseling psychology from the Ana G. Mendez University. For the past 4 years, she has worked within the Guarabí organization with people in medication-assisted treatment, or MAT, people in the process of reintegration into the community, victims of violence, and people that are unhoused. She currently works as a psychologist at the Residential Reentry Center of the Federal Bureau of Prisons in San Juan, Puerto Rico. Sarah Wurzburg is a Deputy Division Director within the Behavioral Health Division at the CSG Justice Center, and she oversees the technical assistance focused on behavioral health, diversion, and reentry, and serves as the lead for projects related to substance use, mental illnesses, and housing. So welcome to all of our presenters for today, and we're very grateful to have you and all the content that you'll be presenting to the field. Next slide, please. So I'm now going to pass it over to Sarah, who will share with you the 5 evidence-based strategies to reduce overdose risk during reentry. Thank you.
Thanks so much, Felicia. Next slide, please. So we're really excited to talk about this really important and meaningful topic today. As part of this webinar, we're going to give you a preview of 2 upcoming publications that we worked on with the Department of Justice's Offices of Justice Programs, Bureau of Justice Assistance, through the Second Chance Act Health and Housing Training and Technical Assistance. So we're going to have 2 primers that will be released, and we're going to go over the primer for reentry professionals to talk about implementing evidence-based strategies to reduce overdose risk during reentry. We're really excited to have 2 grantees who are focused on through the Second Chance Act on Second Chance Month. The other primary that we're going to release is the same topic area, so overdose prevention for people during reentry, but it's focused on getting to family members and the types of questions they need to ask for their loved ones who are involved in the justice system during reentry. So similar strategies, but a different audience and different kind of focus in terms of what we can do to support them. So a big piece of this is just really to think about reentry is a super high risk time for overdose and overdose death, unfortunately. People are at risk, high risk, the first 48 hours and up to 2 weeks following their release into the community. There's a lot of potential reasons for this. One is the stopping of use while a person is in prison or jail. That can certainly affect tolerance. The other is a lot of stress factors when you're reentering the community and going back to somewhere. In some cases, you have not been for a very long time. And some of the research shows within the first 2 weeks after prison that people are 129 times more likely or more at risk for an overdose than other state residences. So the increase in the risk factors are really significant here, which is why we think it's really important to focus on this. Make sure that all reentry programs are really aware of the risk of overdose for people reentering the community and trying to help mitigate that risk of overdose and risk of potential death as well. Next slide, please. So we tried to break this down into 5 strategies, although each of them is a big implementation list in their own right. We just want to acknowledge some of these key focus areas. So the first one is the use of medications to treat opioid use disorder. So, in the past year, unfortunately, over 100,000 people have had an overdose death within the United States. So it's really a trend that has unfortunately kept growing. But what we do know about this is that if we use medications for addiction treatment, it can cut the risk of death by 75% for people leaving the justice system and during reentry. So that is really important just at a simple level. If we're able to provide the medications within correctional facilities to keep people on one of their 3 FDA-approved medications, which is methadone, buprenorphine, and naltrexone, we can really mitigate the risk of overdoses and death, also help with continuity of care, It can also help manage withdrawal within correctional facilities, which can be an issue as well. So you have withdrawal management, you're supporting someone to continue or begin this type of treatment, which will help with long-term recovery and also reduce their overdose risk during reentry. So it's kind of a really important strategy that can be difficult to implement. And there's different jails and prisons who are doing different things. They might not be able to provide all forms of FDA approved medications within their correctional facility, but trying to work towards, meeting the standards and being able to continue people's treatment is really important, and also to continue the care as people reenter the community. So if you're able to start someone on a medication of buprenorphine, making sure there's a plan for when they exit to be able to continue with that ongoing treatment within the community to support their recovery process. Next slide. The next one is ensuring access to naloxone. So if we're talking about reducing overdose death, one of the biggest strategies is access to naloxone. So this is important to really think through because naloxone is a safe, quick acting, non-addictive method to treat overdoses. And so if we're able to distribute these as part of the reentry process, so in some jails, they're able to partner with community-based providers or with local public health or state public health agencies to help distribute naloxone, it can really decrease someone's overdose death upon reentry. This is also potentially an area where family members and loved ones can be very important. So there are some programs in different places across the country where they're able to give the naloxone kit to a family member or someone who is a significant other of the person. So that if the person does happen to overdose, there's the opportunity for someone to be there to help with the reversal medication. So this isn't common in reentry in every community, but certainly something to think through if you're able to provide this as a best practice, and really thinking about who to partner with, whether it be a public health agency or community-based organization or harm reduction service provider that can help provide access to naloxone to help decrease the risk of overdose death for people who are reentering or overdose overall. Next slide. The next part is relapse prevention plans. So when people are reentering the community, there's a lot of different things going on. There can be a lot of triggers. You're going back to old spots, seeing people that you knew from previous. Cravings can increase for alcohol and drug use. So it's really important to have a reentry plan that includes a relapse prevention plan to try to identify these triggers, to develop coping strategies, and really think about plans if there is an emergent situation or if there is an overdose risk or other emergency or crisis within behavioral health, what would be the plan for that? And oftentimes it's important to bring family members who would be, and when I use the term family members, it can be defined by that person. So they can be biological family or just people who they view as family within that system as well, to make sure that there's a support system in place for people to be able to support them as they reenter the community. So when we're talking about reentry plans, we really like to take a collaborative, comprehensive case management model, which is bringing all the people to the table. So people within the correctional institution, the community-based provider, if they're on supervision, bringing that person, if they have another housing provider, trying to get everyone to the table before they reenter, to have one person, like one plan for that one person, and the person's involved in setting their own goals and really thinking through what would work best for them. And if they want a family member or loved one included, then they would also include those people within that collaborative, comprehensive case planning processes. And really the goal of this is to help reduce the relapse and to have a plan in case a relapse does occur. And that will also help reduce recidivism as well. Next slide. The fourth is assessing a person's recovery capital. So recovery capital is really thinking about a couple of different areas. So the personal, so what is that person's strengths? What are their goals? How can we help them meet their goals during this process? Their family and social contacts. So what supports do they have that are positive in the community that they can really lean on? And what are other community things? Are there any activities that they can go to or other connections they would want to make or interests that they they can further as part of this process. So it's really trying to assess internal and external resources that are available to the person with the substance use disorder. And it's really meant just to support the treatment providers and people in reentry planning to really think through the types of services that would be most helpful, the intensity of services, and the support that match the goals of the person, but also would meet the needs as well. Next slide. And lastly, this is a big one, is addressing stigma and training through training and education. So within the correctional field and within reentry professionals, there, in some cases, is a lot of great knowledge of people who use drugs and people with substance use disorders. And in some case, there isn't. So really making sure there's a general knowledge on addiction science and the brain chemistry of addiction as a disease, and why it's important that we treat it, why we would need to use the medications to ensure that people are able to achieve recovery, and that we're really using the best tools we have available to treat the disease of addiction, but also on overdose prevention. So what are some strategies they would need to take in the correctional facility to prevent overdoses, to help with withdrawal management, but also during the reentry processes. So making sure that everyone involved has this education and knowledge, and community-based providers can often help provide this knowledge, or state and local substance use disorder treatment and recovery support service leaders may also be able to help with some cross-systems training to really reduce the stigma, but also increase knowledge. So that way we can reduce overdose as a part of reentry, and really try to follow the best practices to help people and also to save lives. Next slide, I'm gonna pass it over to Felicia.
Thanks, Sarah. That was really helpful. And thank you for sharing those like really comprehensive strategies to help reduce the overdose risk for people during reentry that are specific to the reentry professionals. And we look forward to this resource and also the one that's specific to family and loved ones that will be released soon to the field. So before we get into the panel discussion, we actually wanted you to meet the two folks that we have today that are from the Second Chance Act Substance Use Disorder grant funded projects and the overdose prevention strategies that they have implemented, that their teams have implemented in those specific areas. So first we will start with Marisol, who's from Guarabí in Puerto Rico, and then she will pass it to Reneka from McNabb Center in Tennessee. Marisol? And we could go to the next slide.
Next slide. Hello. Thank you so much for everyone that got connected to this webinar. I'm so happy and so glad to be in here. And I'm going to talk about a little bit of Guarabí, Puerto Rico. Guarabí is a nonprofit foundation that have multiple programs aiming at the population with substance use disorder. Within that, we have some meth clinics in Puerto Rico. We have two regions, the regions of Cagua and regions of Vega Baja. I work as a counseling psychologist in the region of Vega Baja. We have a multidisciplinary team to provide a complete and quality services to our patients. Within we have case management, psychology services, addiction counseling, social worker, peer specialist. We have our doctor and our nurse. And we're gonna talk about a little our target population. We work with people with USD, exit jails or prison across Puerto Rico. That can be a federal jail or some state jail. Some of our key partners in Puerto Rico are the Puerto Rico Mental Health Anti-Addiction Services Administration, as we know in Puerto Rico as AMSCA, One Step Career Center of Puerto Rico, Prison Fellowship International, the Association of Ex-Addicts and Ex-Convict Rehabilitation, and also we have partnership with Pat Stone. And which are our overdose prevention strategies? We're going to talk a little bit right now. In our clinics is our key to treat with empathy and with very respect to our patients. That is our first think that we have to center with this population. We have to let them support them through their recovery process. And in our clinic, we work with Suboxone, the MIT process. And for us, psychoeducation and appropriate medication management is very important for us for a healthy reintegration. So we're going to talk a little bit about the overdose prevention. As I already know, our first and most important strategy is the MIT treatment. Second of all is the peer support services. For us, it's very important that we integrate the peer specialists in our services so they can have another point of view to their recovery and to serve them as an inspired to get to do their path to their recovery. And of course, for healthy reintegration programs, it is necessary that our patients have their basic need covered, and which is why we work together with them with housing support, education, and employment support, through comprehensive case management. For us, it's very important. It's one of the things that we work as a team together. From a lot of them, when they got out of this prison and jail, and they need such as housing, education, their ID, their asserted birth certificate. So to get through a healthy reintegration, they need a comprehensive case management. Additionally, together with the addiction counseling, we create an individualized relapse prevention plan, and we work through them what they need, what they expect their recovery is going to look like, and we work with them through all the recovery process. Also, it's very important for us the accessibility for mental health services. So we have psychology services due to the high incidence of dual mental health diagnosis with substance use disorder. So for us, it's very important that they also have one of the basic needs that is cover their mental health services. So that's a little bit about our project. Thank you so much. So I'm gonna leave it to Janika. Next slide.
Good afternoon, all. My name is Renika Greenlee, and I'm excited to be here today and happy that you all were able to connect. I am with the Jail to Work program at the McNabb Center. The McNabb Center is East Tennessee's leading nonprofit provider of mental health, substance use, social, and victim services. We focus on the individual's well-mind and well-being and provide quality and compassionate care from infancy through adulthood. Some of our different programs throughout McNabb include outpatient care, adult and children crisis services, integrated health, school-based, therapeutic preschool, military services, reentry, substance use treatment from residential care to MAT, recovery and peer support, foster care and adoption, domestic violence, and youth emergency shelters. The reentry program that I'm with is Jail to Work, and we started the program in 2017 and continue to grow and expand each year. Jail to Work is a 2-phase, 7-month treatment and reentry program. Eligible individuals that enter the program receive a court order for early conditional release from custody. They enter into our residential program where they have a safe, alternative living environment and receive co-occurring services. The goals of our program include reducing recidivism, increasing community tenure, recovery and reintegration into the community with skills and practice to build a life worth living. The first week of Jail to Work program, participants develop an individualized recovery plan after they are further assessed for substance use and mental health treatment. While attending intensive drug and alcohol treatment, individual therapy, case management, and medication services, Participants attend daily psychoeducation groups to include DBT, Beyond Trauma, life skills, mindfulness, beyond violence, work skills. They also attend support group meetings. Participants are then employed around week 9, and the program provides that transportation. After employed, the participants began to pay on their court fines and continue to attend the psychoeducation groups and engage in treatment. They then have opportunities for off-campus passes, all while having a supportive and safe environment in which they reside. Some of our overdose prevention strategies include individuals having access to mental health and substance use disorder treatment, Narcan trainings, and Narcan being available to anyone who needs it. There has been an increase of peer navigators embedded within our program. We engage our alumni who have completed the program by giving them opportunities to be a support for those new in recovery. We involve the family in treatment by providing support groups, and we have family days where members can come and interact with their family in a safe and supportive environment. Individuals have access to MAT. We assist them in developing their relapse prevention plan. Participants in the Jail to Work program also have access to other services within McNabb when needed, to include crisis stabilization, detox, and other outpatient services. We in the Jail to Work program understand that connection is a key to recovery and seek to strive towards helping individuals build healthy relationships, support, and belonging in the community. Next slide, please.
Okay, great. So actually, we're going to just shift into the panel discussion, but thank you so much, Marisol and Renika, for the overview of all of the amazing work that both of your organizations are doing at this intersection of criminal justice and behavioral health, specific to the overdose prevention. So if we can spotlight Renika and Marisol, and then we'll get into the discussion questions. And I'm not seeing Renika. Oh, there we go. Okay, wonderful. I didn't want to continue without being able to see both of you. Great. Okay, so we'll start off with the first question, and we'll just take turns, so whoever wants to start. How does your agency identify people with substance use disorders, and what is the process for implementing individualized overdose prevention strategies?
I start?
Yeah, you can go ahead.
So, how do we identify people with SUD in Puerto Rico? We can go through self-refer or government agencies. Currently, we remain very active in our community, so we can connect with them through some health fairs. We also do a little bit of community activities, but we remain active with them. So for us, it's very important to connect with our community and get us to know and gain their trust so they can refer people to us. And first of all, our patient is evaluated by our clinical team on his first day on the clinic. After that, we do a weekly follow-up to their process, and after they gain stabilization, we start with the monthly follow-up and through the medication and through all the psychology and counseling services.
For the Jail to Work program, our staff go into the county jail and we educate all individuals that are currently incarcerated about the program. Anyone that is interested has the opportunity to apply. We then work with the selection committee, do a series of screenings and interviews, and work with court and legal staff on obtaining that judge's order to allow them to enter into the program. Attorneys, probation officers, and other jail to work staff also make referrals into the program. The referral process varies for other McNabb programs to include open access to intakes. We have walk-in centers and other services available to help aid in meeting the individuals where they are and their immediate needs. Regardless of the program, an individualized treatment plan is completed to set the goals and action steps for the individual.
Great, thank you both. So important to be able to identify folks and also get them what they need, right, in those plans. So sounds great. How have staff responded to trainings, and how will you incorporate ongoing education about substance use disorders and medication-assisted treatment? So maybe I'll start with you, Renika. Renika, you're still muted. If you could start over, sorry.
Staff in jail to work seem to be eager to learn more. Here lately, I found that if only 1 or 2 staff are able to be sent to a training, the others are asking if there's something similar that they can attend, or if there's another training that they can do that's similar to whatever the topic was. I constantly remind staff that the training opportunities are for professional development and growth, because it allows them to be more competent in their work. Information about the most recent education and studies on SUD and MAT are shared with staff on a regular basis, and that's done in team meetings, through emails, through center information. And then staff are also encouraged to do their own research and attend trainings and webinars on SUD, MAT to stay up to date on the most current best practices.
And Marisol?
Our multidisciplinary team is very committed to the continuing education. We have a collaborative agreements with the Central University of the Caribbean, with the Mental Health and Addiction Agency in Puerto Rico, and also with the West Care Foundation. They help you out monthly, giving us training and education and continued education to help us to continue developing our clinical skills.
That's wonderful. It's great to hear about how the learning is so contagious and that it's at the forefront at both of your agencies, and you're also working with those partners to help destigmatize substance use and the treatments necessary to help support folks in recovery. So that's so great to hear. Who are your main program champions or supporters, and what did you do to gain their support? So Marisol, I'll start with you.
Our main program champions is going to be, we have the UCC, the AMSCA, that's what I already mentioned, but our main champion is going to be West Care, and what we start working with them on 2015, so they can help us with our clinical training. But our main, but also that is in the administrative way, but our main champions are definitely our patients. We gain their trust, show them empathy and support without judging them through their recovery process. And we want them to make them feel like this is their second home, so they can trust us. And they sometimes come here just to have a sip of coffee and it's a cookie and hey, I want to tell you about my niece, and hey, I want to tell you about my daughter, and gain their trust so we can help them through that recovery process and help them also with their self-esteem that is very, very damaged through this reinsertion process.
I also have our program participants and alumni as being one of the main champions, the main focus. We try to keep participants in the program, and when they complete engaged, and we do that through being that support, that stability piece for them, and knowing that they're always able to come back. Here lately, I've been hearing, the program, it seems like family, it's like I'm going back to a family reunion at times. Another champion is our county mayor. He has been a support of the program since the beginning. He is actually the one that approached us and our center about the needs for incarcerated females in Hamlin County. He done that in 2017, and him and McNabb were able to get this program started. Another champion would be our Chamber of Commerce. They've been able to help us partner with new employers and other businesses in the community to give our women different chances and opportunities to reintegrate into the community. The most recent program champions are county governments from neighboring areas that have heard about the Jail to Work program and are interested in partnering with us to be able to provide reentry services for individuals in their communities. Other champions include various other nonprofits, church groups, employers, advisory boards. We continue to gain support from our community by going and speaking at events, giving updates on program participants, hosting tours of our facilities, and our willingness to partner with other counties to help serve additional communities.
Lovely. Thank you both for centering the people, right? The people that are at the center of this programming and the policy recommendations that we have here, and really making it about them, and ensuring that you have their trust first before you build up from there, right? And that it sounds like the word is spreading, right, on its own because the trust is there, right? So then you can build from that and really expand your reach and get the additional supports that you need. But without that client focus, person focus support and champions, you really won't probably go as far, right? If people don't want to be in your program and they don't trust you. So thank you both for that. That's really amazing. And it's such a good reminder. Next question is a little bit of a different, a different topic about sustainability. But what is the plan for sustaining overdose prevention strategies that you both have at your different agencies after the funding ends from your Second Chance Act grant?
After our grant funding ends, the Jail to Work program, we will continue to take our cohorts of women into the program and follow up with alumni. Staff will continue to attend the trainings to learn best practices and overdose prevention strategies. The program plan is to continue increasing the family component of Jail to Work and to educate the community on reentry and overdose prevention strategies. Our plan for sustainability includes funding from our county government. We are getting a new county jail, so hopefully more involvement with that and applying for additional funding to expand different components of the program.
And also we have some government funding. Also, we have a lot of community support, so that is very important for us. But if the funding ends, we have to transfer our patients to an EVAR clinic. We reinforce definitely the psycho-education of them and in our staff. That is really, really important for us, that they are very committed to their reintegration process and their recovery process.
Right, yeah, it's always as soon as possible, right? Starting with sustainability is important and centering that. And again, that focus on community support and building from there and really leveraging that. So great. And keeping with that trend, would love for each of you to share a participant success story. Of course, with, no identifying information, but, just a success story that you would like to share with everyone. Renika, you have to unmute. Sorry.
I have an individual that entered the program that described herself as alone, lost, at her rock bottom. After doing approximately 2 years in jail, right after the passing of her mother. So in active addiction, she had signed her rights to her children over to their paternal grandparents. So she felt like the only person that she had was truly herself. She was eager and motivated to make changes, had big plans and goals, but we reminded her just to take one day at a time, that everything wouldn't happen overnight, but we would get there. She was always encouraged to use the tools that she learned to stay consistent, focused, and to make her recovery a priority. She did that while in the program and continues to do so now. In our program, we provide our participants with envelopes, paper, and stamps for them to be able to write their family. This lady began writing her children's grandparents, the people who had adopted the children. She was consistent with it and then started having phone calls with the grandparents. About 3 months into the program, the grandparents started allowing her to have supervised phone calls, and then that led to unsupervised, then to supervised visits, attending sporting events, and then unsupervised visits. So 2 years later, this participant has successfully re-entered into the community and has a place on her own. She has a job, license and a vehicle, a GED, and is an active and successful member of the community and the recovery community as well. With all of this being said, she is sober, she is creating a life worth living, and gets to be an active part of her children's life by being able to co-parent with the adoptive grandparent. She is active, present. She continues to be a part of our program by facilitating meetings, being a sponsor, and a support for those that are new on their recovery journey. Her next goal is to become a certified peer specialist. So again, connection is a key to recovery, and myself and my staff at McNabb was able to build a connection with this individual and continue to have that positive relationship in the program and well after her exiting the program.
That's beautiful. Thank you, Renika.
That's a beautiful story, Renika. Thank you for sharing. So a successful story of the problem of our program, it definitely is gonna be a patient that he was a baseball player for college. And then he got some substance use and got arrested and was in federal prison. After his federal prisons, he completed the halfway houses program, and he entered to our program because he didn't have some health insurance, so that he was struggling to get his medication. So our program covered the cost of his medications, and he started in there. And he was a year ago, he started the medication. He has remained abstinent since he started the program, and he currently improved his family relationship because he was on and off with the mother of his children. So definitely we start working in here with some family therapy, counseling therapy, a lot of psychoeducation about the medication, and this is stigmatized all this, but misinformation about what is the treatment and what we're doing here. So for us it was very important that they feel our support, and they have their basic need covered, such as their ID, birth certificate, their employment, and everything that they need through that process, so he can recover and also recover his family. That was really, really important for us too. So he really improved his family dynamic, and he actually got married like 2 weeks ago. So for us was such a great story. And he got together with the mother of his 2 children. So they are all happy, all healthy. He continued to be in our program. He's stable on his job. He continued to focus on his recovery and his family. And we're really, very proud of everything that he achieved in such a 1 year.
Wow, that's so amazing. Thank you, Marisol. It's another beautiful success story. And just a reminder, right, that recovery is possible. If there are supports, if there's evidence-based practices at play and available and accessible to people, and there's that trust and community support, right, people can recover. So I appreciate you both sharing that. And we're going to transition now back to our PowerPoint, just to have a placeholder slide for our questions and answers segment. We got some great questions in. So Renika and Marisol, if you could stay on, and we can, we have some questions for, I feel like everybody got a question. So I'll just go through and do that. So we're going to start with actually one for Sarah, which is asking about rural communities. So I'll just read the question. It says, as part of this effort, is there any focus concerning small and rural jails or communities that don't have community resources needed for continuation of care related to MAT or opioid use disorders?
Yes, absolutely. So through the Second Chance Act, there are grants available. There are actually grants available now for reentry for people with substance use disorders, as well as crisis stabilization and community reentry. So we do work with small jails and rural jails as the training and technical assistance provider for the Department of Justice. And just a couple of ideas on smaller rural jails. And I know you mentioned that you don't have the medications available. So there actually were new rules by the federal government to allow for telemedicine for the treatment of opioid use disorder. So this makes permanent some COVID-19 public health emergency exceptions for opioid treatment programs that allowed the treatment through telehealth, including methadone through audio-visual telehealth technology, and buprenorphine through audio only and audio-visual technology. Ooh, sorry, tongue twister there. So it actually, there are more flexible options. So there might be the ability to partner with a opioid treatment program if there's one available, or with a buprenorphine doctor, a doctor who can prescribe, a doctor or nurse practitioner, depending on your state, who can prescribe buprenorphine as well. It also enables some flexibility around take-home medication of doses for opioid treatment programs. So if there's a brick and mortar building, there's some more flexibility there to do that, as well as allowing patients to start medication while they wait for other further services to begin. So there's kind of these new federal regulations actually make it more possible for the rural jails and small jails to partner with providers through telehealth to be able to provide the medications for opioid use disorder. And if that isn't available in your community, I think there's other things that small and rural jails can consider in terms of partnerships. If there's a hospital available, a community health center, if there's other providers who could be helpful in your community, there are different things you can consider and outreach strategies you can do. The other thing is, a lot of rural and frontier communities might have very active recovery communities. So thinking about recovery community members or community organizations who might be able to support either through volunteer work or through potential funding that you might have available or seek to better support people who use substances in the rural communities. So those are just a couple of ideas, but I think there are some new opportunities that can be explored to develop some of those relationships as well.
Thank you. That was a great comprehensive response. So hopefully that helps. Next question is actually for both of you, Renika and Marisol. How are the services being made known or advertised to people that are either in the reentry process or still incarcerated that will be reentering? And how early are you beginning these conversations with them about what the programs offer, of course, because they are voluntary. So, and how are you working to advertise and get referrals specifically with potential participants?
At McNabb, our individuals come straight from our county jail. So we have resources available there with McNabb information, regardless if it be for our reentry program or other services that are available. We go into the jail pods and educate them on specifically jail to work, but also probation officers, public defenders, and other court staff. We go and speak with them about our program services that are offered, and sometimes they'll want us to come to court with their client to explain the program again to the judge if it may be a new judge. So we communicate a lot with the public defenders, the court staff, probation officers.
In Guarabí, they come through sometimes self-refer. They're here around the community about the program and they come in and just check in. Also, we have a government agreement with the Department of Justice in Puerto Rico. Also, we got around a lot of referral from the federal prison too about probation officers of the federal process too. So they come from various referrals.
Great. And Marisol, I have a question for you from someone who wanted to know, how long does your staff provide case management for participants?
Of course, we could provide an intense case management on the first week, and after they gain stabilization, we start a follow-up monthly as long as they need.
Great, thank you so much. We have some other questions. Maybe Renika, I'll give you a chance. What are some lessons learned in working for a community-based treatment provider agency and going like into the, behind the walls, into jails and prisons? What is that like?
When we go into the jails and prisons, we always encourage them, start learning now, start looking at the resources available to you even before you get into the program, and really try to assess the readiness to change. There's some people that just want it as a free pass out of incarceration, and we start having those conversations up front to say, our program is one chance. If you decide to leave the program, the judge is not going to sign another order if you go back to custody. So I think it's really letting them know, hey, take this chance for yourself, take the opportunity and do something different.
Thank you. And Marisol, did you have anything to add about that, about the experience, any lessons learned about going, working in jails and prisons for your staff that's more community-based?
And definitely we're much more community-based. We don't go through the prisons, but definitely it's a lot of challenge we found in the first 2 weeks of the intense case management. But definitely is, sorry, I'm rereading the question for advantage as someone in recovery foundation, but definitely is a challenge for us. So they can get their life together, but definitely they need some basics needs to be covered.
Thank you so much. And there's a lot of challenges with workforce, right? Like hiring people, hiring staff that are qualified, and also have the experience needed for this important work. So how have you been able to hire and retain staff? And if so, like what has worked, what has helped? Because we get a lot of questions about that.
We have some center initiatives going on for staff retention, such as bonuses and other things like that. But really, our program, we've began since 2017, and I still have 2 staff that have been here since then. It's very rewarding work, and I think it takes people that are just passionate about it. But we're seeing that once they get here, they tend to stay.
Definitely, we have to connect with people that are really passionate about and are really interested to keep learning, because every day we have to keep learning about our patients and about what everything is going on right now in Puerto Rico. For us, it's very important the communication and teamwork, and that can help us to also talk and try to not burn out ourselves, because we're working a lot with this population that is very vulnerable. Then they have some very, very deep trauma history. And for us, it's very important that also we take care of ourselves on time, that we didn't get to the burnout. And for us, if the communication within our team is key to prevent that.
Great. These are great strategies, right? Like making sure you're finding folks and interviewing, in the interview process, asking and about that, the care for the work and the experience and, what brings them to the work, having that great culture, right? To prevent burnout, having some incentives. So a little bit of a mixture and blending of all of those strategies. So thank you. We have 2 more questions. So, do you have any advice for any community-based providers that are looking to start working within the substance use world? And what is that? What would that advice be?
Read, educate yourself as much as you can. By educating yourself, you can challenge your own stigma and can challenge your own prejudice about the medication, the population, and everything that is going through the recovery process. So education definitely is the key to start working with this community. As long as you can connect with them with empathy, with assertive communication, and try to leave behind all the stigmas that we all have, because we all have stigmas, but we have to acknowledge them and to definitely educate yourself to work with this population. And also have your self-care strategies. Don't let that behind.
In addition to education, I would say that find you some champions early on. Someone that is also interested in the reentry work, that you can partner with, that you have for support, because sometimes it feels lonely out there. To try to reduce that stigma, I think the more that you're present, even when it's not comfortable, even when it's challenging, even when you get pushback, I think it's to continue to have those conversations. And also the peer specialist. If you can get a peer specialist to go and advocate for the people that are still struggling with using, I think that they can be that voice. And people, if they can put a face with it, it tends to maybe change their way of thinking or begin to get them thinking a different way.
It's great advice. Thank you both so much. We have one last question, and then we'll wrap up for today. And it's about expungement. So how common is it for the individuals that you work with to pursue record expungement? And are there any advantages for someone in recovery from addiction to receive an expungement?
I have not worked with anyone yet for expungement, but I did go to court this morning, and a lady was ordered into the program, and he was going to give her an 8-year sentence, and then she was eligible for expungement. So after court, I was able to meet with her, and she just expressed another way that this could be a motivator for her. Her charges are, they're felony, pretty intense charges, but she said it was a motivator for her to make the changes, to complete probation, to follow the recommendations.
Thank you. And I'm not sure, Sarah, if you had anything to add before you wrapped up about the expungement piece.
Yeah, absolutely. I think if it's available in your state, it's something that's really important to pursue because of all the collateral consequences to these convictions. And, you know, things like historically, it's created a barrier for housing and receiving federal housing. There's some new guidance that hopefully will destigmatize that and lessen some of the restrictions from the U.S. Housing and Urban Development Agency. But it is important because it can help people access jobs. So depending on your state or territory, some states have been pursuing things like ban the box legislation. So they're trying to look more equally at people's application and not discounting someone because of criminal history. So expungements can be helpful in some of these employment areas, sometimes in housing and other collateral consequences that are associated with these convictions. So if that is available to people, it can be something nice to pursue. And oftentimes there are different nonprofit legal agencies or legal aid that can potentially help you pursue expungement. So you might want to look a little bit into what's available in your state. Some people also don't know that they may be eligible for expungement, so they just don't even know they could apply for it. So I think it is just something that's important to have the discussion about because it can be helpful if it's available to you. So really look and see what's opportunities in your state and if there are organizations that can help you do this. There's a lot of paperwork involved often, so really trying to find a different group in your state that has done this before or can, you know, support partnership can be really helpful.
Great points. Thank you all. So yeah, we're gonna wrap up. Thank you so much to all of our speakers, specifically our panelists for sharing all of your advice, all of the great and amazing work that you're doing in your communities and with people and their families and all the impacts that you're having, positive impacts. So again, we recorded today's webinar. It will be posted on our website within 1 to 2 weeks. If you have trouble finding it, don't hesitate to reach out to me. I can help you find the link or send you the link once it's ready. Again, thank you to everyone who joined today. Happy Second Chance Month. We have 1 more day left. And hope you have a great rest of the day.
Thank you.
Thank you.